the first strategy we're going to be using to relieve our back pain or sciatica, and I will use examples here so you guys can understand and have something to take away. First way is going to be something that is directly helping the injured tissues. It's working at that level, right? And I'll also use a treatment example here as well, perhaps. So when we do something like the bed decompression, or we do something like the towel decompression, we are directly taking pressure off the lumbar spine, right? If we acknowledge that most of the injuries are happening, they are compressive pathologies, meaning we are squashing down on that lumbar spine at L4-5 or L5-S1, which has led to the injury at that segment, usually involving the herniation of the disc or damage to the annulus fibrosus, etc., etc. We have a compression issue at this level here. So if we're doing something like the towel decompression, which is where we take a rolled up towel and place it lying down underneath our lumbar spine to support the natural curve, we're directly taking pressure off that lumbar spine. We're doing a number of other things that are beneficial as well. We are directly taking pressure off the tissue that is injured, right? So we're doing a relief strategy for our back pain or sciatica that's targeting the underlying injury. Another example of this might be in the clinical application of something like laser therapy, where you're using laser at this section here to help with the tissue healing, or decompression therapy, spinal decompression, where you're decompressing this particular section. These are methods which are working directly on the target injured tissues to help them go through a healing process, right? That's the first category. That ideally is going to be the premier strategy, the one that actually is doing something direct. Then a significant number of the next lot, or rather a significant number of the stretches and the strategies that you're going to deploy to relieve your back pain and sciatica are going to fall into this next category, which is number 2. These are indirectly going to help that area. So for example, if we take a hamstring stretch, the hamstring stretch could fall into category number 3 if we perform a hamstring stretch correctly, or we use a massage gun to work on the hamstrings, obviously being reasonable. We are going to have an indirect effect on the lower back. So we might well do our little hamstring stretch, boom, we can feel the stretched hamstring, hold it there, we do 30 seconds, whatever it may be, and we're going to get an instant increase in the mobility of the hamstrings. Why is this important? Because when we are moving, when we're doing things, etc., moving through daily life, our hips, if our hips are a little bit more mobile, if we've eliminated some of the stiffness at the level of our hips, it means that our lower back has to do less. If I have very, very, very stiff hamstrings and I want to get into the chair, if my hips are really, really stiff, I have to round my lower back to get into the position. If my hips move a little bit better because I've loosened off my hamstrings, I can sit more readily with a neutral spine, and therefore it has an indirect effect on my lumbar spine. It's taking pressure off the area, the target area.